Okay? This video is on children and chiropractic. One of the most important things to remember and to teach children as a parent about chiropractic and other forms of holistic healing is that the body has the capacity to heal itself naturally. So we're not putting anything in, we're not taking anything out, we're restoring the function of the body. In chiropractic, we restore the nervous system that regulates everything. Now, when you introduce your child to healthcare and you provide them with a medicine, the implied message is to that child that they need something outside of themselves to heal themselves. That is not the truth. What they need is their body to restore itself, and that if there is a problem with that, that needs to be checked by the chiropractor and restored. So you're teaching your child, your children, that we're not in this drug pursuit, healing from outside in. We're doing nature. The body's an integrated whole, heals from the inside out. We just have to restore it. Its function, the body's function, gets distorted through different kinds of stresses, mental, emotional, physical, and environmental. And Lord knows, all of us face challenges every day, and your children are no exception. Your children get stressed in many ways. This then distorts the brain and nervous system. That then distorts the communication between the brain and the body. So when we talk about conditions that children have to treat, there's no condition we treat other than restoring the function of the nervous system. Now, things that are common to children are infections. Their immune system is immature. They need to gather together with other children with all kinds of little bugs and viruses and microbacteria so that they can be exposed to them, fight, and their body, once it's gone through an infection, learns this, stores the memory, and strengthens itself. So infectious diseases are common among children. The problem is if your child has a recurring infection, that's a red flag. It's always a sore throat. It's always a sinus infection. It's always a headache. It's always a chest, a breathing problem, a respiratory problem. Those are red flags. That means that the nervous system is inhibited. The communication is inhibited within the nervous system from the brain to that part of the body, and that part of the body back to the brain. The job of the chiropractor is to locate that. We call that subluxation. In medicine, that term's partial dislocation. It is not a medical term, it's a chiropractic term. And it means that the nervous system is distorted, the central nervous system, not the peripheral one. So we need to check the spine where the central nervous system is located, find that irritation or subluxation, and restore it. Now, the beautiful thing about children is they're only so old, which means that they haven't had their problem for 30 years like mom and dad. And they respond very quickly and do not need many sessions to restore the function of their body. And when their body restores and they feel better, they learn their body can heal itself. It's a natural process, and that's what chiropractic's all about. What I want to discuss now is why chiropractic? Why choose this? You know what it is. It's important to remember that children are developing. And if they have a problem and it goes unresolved, their brain has no choice but to adapt and reformulate itself to accept that this problem the child has, which is chronic in nature, even if it is recurring, that's a chronic thing, is now their new normal. So their brain now says this problem is a part of being your child's normal. So we need to make certain that doesn't happen. And the way that we do that isn't by watching your child get hurt or have a problem or a headache and then that symptom go away. The symptom is just a symptom. It's telling you that the body can no longer cope with whatever's going on. So we have a symptom. A lack of symptoms doesn't mean the problem's corrected. It means that the body is now able to cope with this problem such that you don't have a symptom. And you have to lose at least 50 to 60% function of any part of your body before you get a symptom. So if you want your child to be healthy, they not only have to correct that symptom or improve to the point where they don't have the symptom, but they also need to correct the cause of that symptom and improve their body to an optimum. So out of symptom doesn't mean their body's functioning at an optimum. It just means it's functioning well enough not to have the symptom. That's why you need to bring your child to get checked and corrected. Now, conditions that chiropractors treat. Of course, if we treat the nervous system and the nervous system controls everything, we treat everything. We don't treat the condition, we treat the patient. But very common things that happen to children also happen to adults, and that is musculoskeletal issues. Children are involved in a myriad of things, but more so than ever, children have tablets, phones. They're always looking at a computer screen or a phone, which is down and forward. Their head's cocked forward and it's held that in position for way too long. If they're fortunate enough not to be hooked on a phone and they're involved in a lot of activities, from playing the piano to dance to swimming to taekwondo to gymnastics, you name it, you can get strains and sprains, and children will tell you if they have an ache or a pain. If that ache or a pain goes away in a day or two, that might be a normal thing. If it recurs, it is not normal. Even if that pain goes away, it's good to have them checked to make certain that that problem is, the body's been able to heal itself completely. So whether they have a problem with their shoulder, their middle back, their chest, their leg, their knee, their ankle, their wrist, it doesn't matter where, the chiropractor can check the nervous system, check the joints that are involved, restore the function, and restore the body's capacity to heal itself. Now, aside from musculoskeletal issues, there's a couple other things that children, young children, often experience in addition to the infectious illnesses that are extremely common. One of those things is bedwetting. And this has been scientifically shown that chiropractic is effective in bedwetting. Somehow, there is a disconnect between the brain's ability to regulate the urinary tract system, male or female, it doesn't matter. The job of the chiropractor is to find out where that disconnect is, called a subluxation, and remove it. Children heal quickly. The longer this problem goes on, if you never have this child checked and they sort of quote unquote outgrow it, whatever that means, is that after 3 or 4 or 5 years, their body has somehow learned to deal with this. It doesn't mean that problem is gone. They've just figured out how to cope with this bedwetting issue. You must treat the cause of the problem. Another common problem that children have, as well as adults, are headaches. Headaches are not normal. There's different kinds of headaches that medicine has categorized that sort of explain the nature of the headache. Well, we have a neurologic headache, which is migraine-like. We have tension headaches, which is muscular. It doesn't matter what kind of headache you have. If you have a pain in your head, no matter what area of your head you have that pain, your eye, your sinuses, your temporal lobes, your forehead, the back of your head, it's a pain and it's not normal. It means that your brain is unable to regulate that part of your body, unable to heal it. That is the job of the chiropractor to check and correct that. The sooner that it's done, the better. If you want your child to go into adulthood with headaches and become chronic and take medications, this is not the right choice. We're into restoring the body's capacity to heal itself naturally.